5 Best Tools to Fight Depression. Depression is an extremely common mental health issue that can impact anyone, regardless of age, gender, or race. While there are many ways to treat this condition, using certain tools and techniques can often be helpful in managing symptoms. Statistics suggest mental illness may account for 32.4% of the global burden of mental illness, and mental illness may account for 32.4% of the global burden of mental illness. Source: Vigo D., Thornycroft G., Ayton R., Estimating the True Global Burden of Mental Illness. Lancet Psychiatry. 2016, 3, 171-78, and World Health Organization, 2012. In this post, we will discuss 7 of the best tools you can use to fight depression. Keep in mind that everyone's situation is different and what works for one person might not work for another, so be sure to consult with a healthcare professional before starting any new treatment plan. What are the causes of depression? Depression can be caused by a variety of factors such as genetics, physical or psychological trauma, or even a change in environment. In addition to these triggers, stress and negative thinking patterns can also contribute to feelings of depression. Let's dig deeper into each factor. Genetics. Genetics can play a role in increasing an individual's risk of depression. Studies have found that people with a family history of depression are more likely to develop the disorder themselves. Physical or psychological trauma. Physical and psychological trauma, such as abuse or loss, can also contribute to feelings of depression. Change in environment. A sudden change in circumstances, such as a move, job loss, or relationship breakdown, can all trigger symptoms of depression. Stress. High levels of stress can be a factor in the development of depression. Stressful life events can cause an individual to experience prolonged periods of sadness and low moods. Negative thinking patterns. Negative thoughts about oneself or the world can lead to feelings of depression. People who struggle with negative thoughts may experience more intense and frequent bouts of depression compared to those without this issue. Now that we understand the causes of depression, let's talk about the symptoms. What are the signs and symptoms of depression? Some common signs and symptoms include persistent low moods, lethargy, difficulty concentrating, changes in appetite and sleep, feelings of guilt or worthlessness, and thoughts of self-harm. It is important to note that everyone experiences depression differently, and some people may not display all of the signs mentioned above. If you are struggling with any of these symptoms, it is best to consult a healthcare professional for advice on how to proceed. Now, let's discuss the various types of treatments available for depression. 1. Medication. There are various medications available to treat depression. Your doctor can help you decide which one is right for you. 2. Therapy. Certain types of therapy, such as behavioral therapy, CBT, has been found to be effective in treating depression. This modality focuses on identifying and addressing negative thinking patterns and addressing the underlying causes of depression. 3. Exercise. Regular physical activity helps to increase endorphin levels, which can help boost your mood. Even low-intensity activities such as walking or yoga can be effective in managing symptoms. 4. Self-care. Taking care of yourself is essential when it comes to managing depression. This can involve spending time with friends and family, getting enough sleep, eating healthy foods, and engaging in activities that you enjoy. 5. Lifestyle change. Making changes to your lifestyle, such as reducing stress, cutting out unhealthy habits, and developing a healthier routine, can help improve the symptoms of depression. What can you do to help someone who is depressed? When someone is experiencing depression, it can be difficult to know what to do to help. Here are some suggestions that can help. Listen. Offer a listening ear and show your support. Let them express their emotions without judgment or trying to fix the problem. Encourage self-care. Help remind the person of self-care activities that can help alleviate the symptoms of depression. Normalize help seeking. Remind the person that it is okay to seek professional help and encourage them to do so if needed. Be patient. Understand that depression takes time to heal, and it may take several attempts before finding a treatment that works. Show patience and understanding during this process. Be there, provide a safe, non-judgmental environment for them to talk about their feelings and express themselves without fear of judgment. These are just some of the ways that you can help someone who is dealing with depression. It is important to remember that everyone's experience is unique and it will take time to manage the symptoms and find the right treatment plan. If you feel that your loved one is struggling, be sure to reach out and encourage them to seek professional help. Resources for people living with depression. There are a variety of resources available for people living with depression. Here are some that may be helpful. Pillars of Wellness. Speaking to a qualified counselor or therapist can help with managing and understanding the symptoms of depression. We offer in-person counseling or online counseling via video calls or phone. Support groups. Joining an online or in-person support group can provide much-needed social support during difficult times.